that even with this Chicago case, the health risk to the general public from novel coronavirus remains low at this time, both nationally and in Chicago. That this is a single travel-associated case, not a local emergency. The patient is a Chicago resident. The patient is a woman in her 60s. Most importantly, I'm pleased to report that she is clinically doing well and is in stable condition. She traveled to Wuhan, China in late December and returned to the US on January 13th. A few days after arriving home, the patient began to feel unwell. She called ahead to alert her doctor to her illness, rather than just presenting to a clinic or emergency department. This is exactly what any potentially ill returning traveler from Wuhan should do: call ahead and seek medical care. This patient's doctor's office appropriately asked about travel history and quickly put a mask on the patient, helping limit the potential risk of spreading infection. Her doctor then referred her directly to a hospital with infection control capabilities for further workup. The patient is clinically doing well. She is currently in stable condition and remains hospitalized primarily for infection control. This is exactly what we've been educating local healthcare providers to do. Ask about travel history and reach out to your local public health department to discuss any ill patients with recent travel to Wuhan, China. She was not symptomatic when flying. And based on what we know now about this virus, our concern for transmission before symptoms develop is low. That she has not taken public transportation. She has not attended any large gatherings. And actually, to our best knowledge at this point, she has not had extended close contact with anyone outside her home since returning from China and prior to admission to the healthcare system.